Hello, and thank you for having me. My name is Kim Musheno, and I am the Vice President of Public Policy at the Autism Society of America. And I've been in the disability policy arena for over 25 years. Today, I'm going to be talking about respite care and specifically some federal resources that may be available for building statewide respite programs. And I'll be sharing with you, going over some of those federal laws that are in existence and other resources to build statewide respite programs. So first, I'd like to tell you a little bit about the Autism Society of America. The Autism Society of America is the largest and oldest organization representing people with autism and their families. We've been around since about 1965, and it was formed by parents in a time when autism was not very well understood, and there weren't very many programs, if any, that really helped people with autism. Now we have approximately 77 affiliates that are nationwide, directly supporting people with autism and their families. So today I'm going to talk about respite. And first I'm going to start out with some facts. A majority of families right now are caring for at least one adult, or someone between the ages of 18 to 75%. A majority meaning 54%, according to the AARP, who did a survey. And there are nearly 14 million children with special health care needs and about 6 million that have intellectual or developmental disabilities, such as autism. And we also know that most of these individuals are at home with their families. In fact, about 75% of people with autism and other developmental disabilities are living at home with families. So these caregivers need supports. So what's respite care? Respite care is one part of family supports, and it is the most asked for type of family support that we get every day. So respite care is, according to the definition in the Lifespan Respite Care Act, planned or emergency care provided to a child or adult with special needs in order to provide just temporary relief to family caregivers who are caring for that child or adult. And there are all types of respite care. Respite can be provided in the home. It could be directed by the consumer, meaning the family or the individual. It can be provided by home care agencies, or the respite care can be provided by volunteer programs. Some individuals use out-of-home respite care, like adult daycare or child care centers. Some get care in facility-based settings, such as hospitals, nursing homes, or assisted living. And there's also community or faith-based type services. Or you could have a provider that comes into the family home or another provider or a provider setting. Respite is so important because it can really help to improve family caregiver stress levels. We hear this all the time, how difficult it is for families that are caring for children or adults with special needs. This respite can really help benefit the caregiver's physical and emotional health. Taking care of others, as we know, is just takes a lot of energy. And so just having a short break can really help individuals who are caretaking. It can also improve the overall family well-being and family relationships and the stability of the family. It can reduce isolation for individuals with autism or the family members who feel like they aren't able to get out very much because of the needs of the individuals. Or some families, some families tell us that they haven't been on vacation or on a date in years. Respite can also help just to get a break so that you can go get your hair done, make it to a medical appointment. And, you know, it just really helps if you can get a break, and it reduces, it often reduces families' decision making to get more costly types of foster care or institutional placements. And it just, like I said, just people just sometimes need a break. I happen to be a family member of a person with autism, so I've experienced this firsthand. My brother-in-law, his name is Bill, and he lived with us for 3 years. And my partner and I, we literally only got 12 hours of respite care per year, and that's just not enough. There needs to be more help for families. Why is there so little help? Well, some of the barriers, of course, the big one is there's just limited funding. There's limited funding from the federal government and very limited funding from state governments, and I fear that will be worse following this public health crisis, the pandemic. The costs are high. Of course, if you want good care, you have to pay for it. And it's really hard to find qualified respite providers. You have to be prepared to pay for it, either out of your own pocket or if you can get, like I said, public support. And then even if you have the money, there's really limited options. There's a very big problem with finding qualified providers, people who are trained specifically to help people with developmental disabilities like autism. Some individuals have very little support needs, and family can get babysitters, but some individuals with autism have significant health, medical, or behavioral needs that really requires training. And then families often are reluctant to even use respite. They're reluctant to ask for help or even to identify as having any needs. And then there's access issues, access to things like transportation to get to and from a respite program. And then there's eligibility restrictions. Some states you have to have a certain type of disability to get help, and that's very restrictive. And then families just have a hard time finding the information. So we really need to work on some of these barriers. So now I'm going to go over some federal laws that are on the books that help people with autism and their families. One that's very near and dear to my heart is the Lifespan Respite Care Act. And I was fortunate enough to help from the beginning to get that law passed, and I'll tell you more about that. There's also the Older Americans Act that has within it the National Family Caregivers Program. And there's Medicaid. Medicaid provides optional services under the Home and Community-Based Waiver Program, and that's actually the biggest funder of respite care. And then I'll talk about the RAISE Family Caregiver Act that was recently signed into law. So first, the Lifespan Respite Care Act. This bill was originally passed in 2009, and as I said, I was able to be involved in the development of the legislation from the ground up. It was championed by then Senator Hillary Clinton from New York and Representative James Langevin from Rhode Island. Representative Langevin is still very involved in continuing to support the law. So it was passed in 2009. It grew basically from several states who had built statewide initiatives, and so the law was based on their models in Oregon, Oklahoma, Nebraska, and Wisconsin. They all developed statewide programs to support people across the lifespan, and so therefore the bill was based on their great work. And the idea is to build coordinated systems, not just one program, but coordinated systems of accessible community-based respite services for all caregivers, regardless of age and regardless of the special need. The Lifespan Respite Care Act, as I said, is a federal, it's now provide federal grants. They provide competitive grants. In fact, they just announced the round of grants that were awarded for 2020. And I'll give you the website later for where to find those. But the problem is there's just not enough money for the whole country. We fully expected for the program to grow and for more money to be appropriated every year, but so far it's only been appropriated every year between 3 and 4 million. We're hoping the appropriations has not been completed, and we're hoping for a significant boost of funding when the current fiscal year's funding is finalized. Then there's the National Family Caregiver Program. This program is authorized by the Older Americans Act, and it gets a lot more money. It has 150 million authorized. And respite is just one of the supports offered through this program. Individuals that are eligible for respite under this program are families that are providing cares for those that are 60 years or older, grandparents that are 55 years or older that are providing care to children under age 18, grandparents, parents, and other relative caregivers 55 years of age and older providing care to adults 18 to 59 with disabilities. But they have to be related by, blood or marriage or adoption, very specific. So it's mostly for older caregivers. And as I mentioned before, Medicaid Waivers provides the most amount of money for respite and other family supports. And this is through the Medicaid Waivers. And it probably is providing the most amount of, it's probably the biggest source of funding for Pennsylvania, as it is in most states. So each state develops their own waiver eligibility and criteria and conditions for specific populations. And the waivers are subject to federal approval. Unfortunately, as most of you know, many states maintain waiting lists for Medicaid waiver services. So it's not an automatic entitlement as is a regular Medicaid state plan program services. Although now the federal rules have changed that states could convert their Medicaid waivers to state plan benefits so that they don't have to ask for the federal government to waive the services. And you could try to work with your state government and try to advocate for your state to do that and include waivers that includes respite care right into the state Medicaid state plan. And I encourage you to do that. Some of the other federal funding sources for respite include, but are not limited to, the Social Services Block Grant, the Child Development Block Grant, the Child Abuse Prevention and Treatment Act, or CAPTA, has a small amount of funding for respite as a prevention activity. And states frequently use money from these sources and enhance it with state funding. And then, the problem is all these different funding sources, you have to try to bring it all together to build out a stable system so that people understand where to go to get the respite services. Sometimes a state will appoint basically a lead provider of respite. Some of the providers that do offer respite for people with autism and other developmental disabilities include some of our Autism Society affiliates, but more often it's programs provided by Easter Seals or the ARC chapters or chapters of the United Cerebral Palsy, Lutheran Services America, or Catholic Charities and other faith-based organizations often provide respite care for individuals. Finally, there's the RAISE Family Caregivers Act. This is the most recent federal law that was passed in 2018. There's a lot of recognition in Congress and within the administration that that there is a need to support family caregivers, because family caregivers are providing a real service, and they're unpaid. So we need to support them. So Congress does realize this. The problem is there's really no new money, meaning Congress is focused on trying to maintain or reduce the debt and the deficit, and therefore, in order to put more money into one program, then they feel necessary to cut another program. And so that makes it very hard to increase the amount of funding for services like the Lifespan Respite Care Act. So instead, Congress at least passed this new law that will at least start talking about and developing a national strategy to assist family caregivers. And it's called the RAISE Family Caregiver Act, or RAISE actually stands for Recognize, Assist, Include, Support, and Engage. And that law, like I said, it didn't provide any additional funding for direct services, but it established a Family Caregiver Advisory Council. And that council is now tasked with creating a national strategy to support family caregivers. And that council does have representatives on it that understand developmental disabilities and autism, which is great. And it has been meeting and trying to develop strategies. And what we're hoping for is that it will result in additional funding to support family caregivers. So then we had the pandemic, and that began in March. And families have been hit so hard with many of the programs that support people with autism and other intellectual or developmental disabilities. Many of them are shut down. Employment programs have shut down. Schools were closed. And it's been very difficult for families. Some families have more than one family member with disabilities. They could be caring for an aging parent and have a child with developmental disabilities, or some have multiple children with developmental disabilities, and they're hit the hardest. And then they're dealing with employment themselves, and trying to help students with distance learning. So it's been very difficult, and the need for respite and other family caregiving support has increased during the pandemic. So the federal government did respond by providing some flexibilities in the Medicaid programs. For example, as early as May, 35 states reported that they had amended their Medicaid home and community-based services for adults and their family caregivers to ensure access to supports and services during the COVID crisis. The CMS, the Centers for Medicare and Medicaid, they basically made Appendix K waivers available. So under Medicaid 1915C, they provided an Appendix K, and this was to provide temporary or emergency specific changes to allow states to target populations such as children and people with intellectual disabilities, developmental disabilities, and provide them support. And that could, and some of those waivers were written by state officials with help with advocates, and some of those waivers included respite care. And many of them still have those waivers. And if you are an advocate in the state, it's good to check on those and to advocate to make sure that those are extended, because the public health emergency has not ended. There's also supports provided, new flexibilities provided in home and community-based services specific to caregiver support. I don't think that Pennsylvania was specifically got some of these, but I know that many states use flexibilities to also get different ways to reimburse families to provide the care that's needed. And while Pennsylvania was not one that did that, that doesn't mean that advocates could not still try to do that. The Autism Society of America has been working very hard to advocate for additional funding in Medicaid for home and community-based services in the next COVID relief package. Congress, to deal with the pandemic and help states and families, did pass 3 bills that total about $3 trillion. Mainly the money went to hospitals where they were overrun with patients, and so it was very necessary to get personal protective equipment and masks and testing equipment and things like that very quickly to the states and to the hospitals and to nursing homes that were hit the hardest. But what we've been advocating for in this next package that they're still negotiating is more money for the Medicaid program. We're urging for a bump in the Medicaid matching rate so that states can provide money for direct support professionals, including respite providers, to support families. So this is ongoing, and we would love for you to help us by reaching out to your members of Congress and asking them to include money specific to people with disabilities in the next COVID relief package. And at the end of this presentation, I'll point out our website where you can get more information and tools to help. So in the state of Pennsylvania, it was made clear to me that there's interest in developing a statewide respite program. And I would really encourage advocates in Pennsylvania to look into the lifespan respite care program. I know I did a little research, and I do know that Pennsylvania did receive one of the first grants under the Lifespan Respite Care Act, and that was probably to begin to build a statewide respite program. But these grants, you can still apply for expanding the activities in Pennsylvania. And I encourage advocates in Pennsylvania to do that. Some of the lifespan respite grant activities include things like building a respite registry, connecting families to existing respite care, building volunteer programs, and using faith-based respite programs, just promoting informal respite opportunities. There's this really great program called the Charting the Life course that helps families to find informal respite opportunities through things like your local library or sports programs that exist for everybody in the community, but you hadn't thought about having your daughter or son to get involved. There can be activities in the neighborhood that is informal respite. So I highly recommend thinking about informal respite opportunities and getting the information on how to do that to families. And then the state advocates could think about building a voucher program or being very intentional about getting college students to help. I know one state used nursing college to build a respite program around and got their young nursing students to be involved in the respite program. So it takes some innovation and strategies. And then there's also, public sector type national strategies for expanding respite options. You could consider the lifespan approach as a state model. Think about making permanent flexibilities currently approved in the home and community-based services Medicaid waivers that were granted under the pandemic, and just make those permanent. A lot of states are now moving to a managed care model for their long-term services and supports. Advocates should get involved and ensure that respite is one of the benefits in the managed care programs. Advocates could make sure that respite is a benefit in a traditional fee-for-service Medicare program. Or they can try to expand the Medicare and Medicaid hospice benefits to alternative settings. And some ideas for public-private partnerships for expanding respite could include addressing respite provider shortages through innovative recruitment and expanding training opportunities. Providing incentives to private insurance companies to include respite as a benefit, supporting business roundtables to encourage employer support for respite, and encouraging the expansion of evidence base for respite and doing research into that evidence base. So see, these are some of the ideas that you could do at the state level. You can also help advocate at the federal level. As I said, we would really like help for you to talk to your members of Congress and their staff about the needs of family caregivers in the state of Pennsylvania. And you can help me because in the next Congress, we'll be continuing to advocate for more federal funding for respite in the Lifespan Respite Care Act and all the other federal programs that I mentioned. We'll be working on annual appropriations for those programs to increase it. And you can help by doing that as well. We are also trying to, there's a bill in the current Congress to reauthorize the Lifespan Respite Care Act. And the Congress is about ready to recess until next year, but next year we'll be working again to try to reauthorize the Lifespan Respite Care Act, and you can help us advocate for that. And then, as I mentioned, the RAISE Family Caregiver Advisory Council, I believe it meets quarterly with the Administration for Community Living. You can actually, Google that and watch some of the archived meetings that they've held, and you can contact the Administration for Community Living and provide your own recommendations for how to develop a national strategy to support family caregivers. So these are just some of the ideas about how you can advocate for more programs and for respite in the state of Pennsylvania and also nationwide. A lot of the information that I have provided today, I got through the Arch National Respite Network and Resource Center. And I happen to be on the advisory committee for the technical assistance under the Lifespan Respite Care Act. And I just really love the information that the Resource Center provides. And I'm going to give you the web address. It's www.archrespite.org. That's ARCH respite.org. And one of the great things about the Resource Center is it provides information for consumers, for families, professionals, and advocates. And it gives ideas for how to build a statewide lifespan respite program. It gives ideas about what other states are doing. For example, it includes some of the best practices that are being used by other grantees. It even provides a summary of grants that have been won in other states, and that can give you ideas about what other states are doing to develop their lifespan respite programs. It also provides a respite locator so that you can find respite in your state and all states across the country just by selecting the state, and it will list some of the information in the state. It's also got a link to the Elder Locator website, again, that provides caregiving information for elder programs. And just fact sheets that could be handed out with information, and just an immense amount of information. So I encourage you to go to archrespite.org and explore that website. In addition, I hope that you will visit our website at the Autism Society of America. The web address is www.autism-society.org. And right now, because of the public health emergency or the COVID-19 pandemic, we've been trying very hard to provide family support directly to individuals with autism and their families. So we have a COVID-19 toolkit that we've been continually updating. It has information on the federal legislation that I was mentioning related to COVID, so public policy information, and lots of resources to assist families of students with in special education who are distance learning or in school, and how to help those students. It's got information for individuals with autism and other developmental disabilities. For example, we have a whole Facebook Live series where we have been inviting experts or individuals with autism to share how they're dealing with the pandemic and to give individual advice or expert advice. Using our panel of professionals, we've been giving advice to families about how to deal with stress and anxiety during the pandemic. Again, we had I think two Facebook Live editions on the subject of education, employment, and all kinds of topics. So I hope that you will visit the Autism Society's toolkit for COVID-19. There you can also get all types of information for people or families of those with autism. And you can sign up for our newsletters. We have a general newsletter as well as a public policy newsletter. And so I hope that you will take advantage of this. You can also contact me directly. Because this was a pre-recorded presentation, I'm not able to take any questions from the audience at this time, but you can feel free to email me at kmusheno@autism-society.org. That's KMUSHENO @autism-society.org. And I thank you for listening to this presentation, and I hope that it was helpful. Thank you again. Bye-bye.